So can I see Rose?
Hi, yeah. This is Rose.
All right, well, let's go back to her room.
All right, ready, babe?
How old is she?
1 year and 4 months.
All right, Rose, let me take a listen here. Heart and lungs sound good. Eyes look great. That ear looks good. So does that one.
We had her about 3 weeks, and I didn't notice though. I mean, we handled her quite a bit.
So it's a mammary-based tumor. You should get this mass off.
Okay.
So let's go up front and we'll get you all scheduled.
Put her back in.
Right now it's not too big, so now's a good time to get it off. The tumors do seem to be under the influence of hormones, so getting her spayed will help to prevent her from developing other ones. There is a chance that this could be a malignant tumor, but the malignant tumors are much less common than the benign ones.
Was she? I know, it's okay, baby. She's gonna be okay. She's gonna be fine, I promise. Madison was really upset. I don't think that Madison realized that we actually had to leave her here. She's been a little bit worried last night and this morning, so it's gonna be a rough day.
So basically what we're doing is filling this chamber with a mixture of the anesthetic gas and oxygen. Starting to work.
To keep Rose under during surgery, Dr. Byert gets creative with a surgical glove.
The hole in this mask is a lot bigger than my patient's head. So we got to do a little MacGyver thing here. So I got a little tiny hole, make it a little bit bigger. I learned this so long ago that I don't even remember where I learned this. I'm gonna take the tumor off first, and then we'll move on to the spay. Hey, Morgan, could you grab me a scalpel? I don't have a very big patient, so I can't allow for very much bleeding to occur, as there are very small vessels in here that we really can't see. I always am concerned that I'm gonna find a bigger vessel. Small errors can lead to big problems. If I stretch them, that's gonna help them not bleed. If I cut them, then they're more likely to bleed. So as I get to vessels that bleed, we're gonna cauterize them so as much blood stays in the patient as possible. The longer I have my little patient under, the longer it's gonna take her to recover. So what I'm gonna do, I could dissect through this little pedicle. I know there's a vessel in there, so I'm gonna tie that off, and then I can get rid of that quicker, because I still have to get her spayed. Okay, thing one is done. These tumors are under hormonal influence, so if we get rid of the ovaries, we get rid of the hormones, we'll have less incidence of the tumors. This is my first spay on a rat. The trickiest part of the spay part of the procedure is just making the initial incision through the skin. Didn't want to press too hard and end up in the abdomen, but still needed to get through the skin. The tissue is none too sturdy. That fits with the size of the patient. All right, looks like nothing's bleeding, so we are just about done. Both the mass removal and the spay went very well. It took a little longer than I'd like, but I don't think that's gonna decrease our ability to get this little kid home with her mom. All right.
I've never actually seen this done.
I'm trimming them just because if I don't, then she has full access to my sutures. There we go. It's one of those things, these guys have a neck that's bigger than their head, so we can't use just an e-collar or something like that to prevent them from doing this. Pain management is a big part of preventing them from chewing, but if it hurts a little bit, they'll wake up and start chewing on the incision. Hopefully we won't get any more tumors developing. If we do, they should be smaller and not as aggressive in their growth. Done.
Good job. She's cute.
You're so excited. Huh? You get to see her? Hi. We're gonna pick up Rose.
Let's go ahead and go back to room
Okay,
2,
great.
and I'll go grab Rosie.
Great. Ready?
Is she your favorite?
She has been so excited. Oh my gosh, I'm so relieved. She lost a hamster just in the past couple of months, and it was really hard for her. So to lose Rose, who she's super attached to, would have been devastating. So we're so excited.
Dr. B,
What's up?
her mom is here.
Okay, let's take her up front then.
Okay.
When I picked Madison up from school, I told her that the doctor had called and that Rose was fine and that we could go and pick her up.
Where is her?
I know, baby. She is coming.
Rosie.
Rosie. Who is it? Who is it? Who is it? There she is. Hi, baby.
Look at her.
So she's still a little bit groggy
Hey,
because of
sweetheart.
the anesthesia,
Okay.
but she can come out.
Hi, sweetheart.
She knows you're here.
Sweetheart. Oh,
Okay.
goodness, look, baby.
Oh, her little owie.
So that's where we're gonna be really careful.
Yep, need to be really careful with those.
Okay. She says, hi, mommy.
Oh.
She missed you.
So, we've got some meds to go home.
Okay.
This one I want you to give tonight.
Okay.
She's gonna get that twice a day for 7 days.
Okay.
And then this is the pain medication. So inside here is the syringe that goes with that. All right.
Okay.
So I trimmed the incisors so that she can't remove the sutures now.
Okay. So
in
top and bottom.
top and bottom.
Oh, okay.
She'll still be able to eat pretty much normally. But I did that purposely so that she doesn't take out my sutures now.
Okay.
Their neck is bigger than their head.
So they can't wear like a cone.
So yeah, a cone just comes right back off.
Thank you so much.
No worries. You guys have a great day.
Thank you.
Have fun, guys.
Thank you.
Bye, guys. It was nice
Bye.
meeting you.
Bye.
Bye, Rosie.
They seem to be pretty darn happy that Rose was back with them. It's always great, no matter what animal it is, to get them back with their family. Especially when the family loves them as much as Rose's does.
Can you get the door for mommy? Oh, here. Oh, you are so strong.